remarkable person in many ways. He tells it like it is, and we're just grateful that he is willing to share, and he's so generous with his time, he's willing to share some of his experience. So please give a warm welcome to Dr. Wyman.
Thank you so much, everybody. My name is Dr. Abdul. My friends call me Andy. I have the privilege of serving at one of our community health centers called Brookside Community Health Center in Jamaica Plain for a good 5 years. I'm now in private practice. We have a practice in Quincy, in Cambridge, and in Saugus. And it is a rule that we accept Masshealth because there should be no disparities between who gets dental care and who doesn't get dental care. So I'd like to share with you a little bit of my experience from the clinician side as to how we provide care and some of the challenges we face when we're providing care to our constituents. And obviously without great legislators, we wouldn't be able to do our job. In 2002 and in 2010, dental care, Masshealth dental benefits were severely cut. And it was time for us, the doctors, to wake up. Because there was a problem. And we need to recognize what the problem was. And the problem was our legislature and the people did not understand the critical nature and the importance of oral health and how it's related to total health. Because if there was a clear understanding, there wouldn't have been such cuts. The problem goes all the way back across the nation. In 2000, the Surgeon General recognized an oral health epidemic, and he called it a silent epidemic because awareness just wasn't there. People didn't understand the importance of oral health and its interrelations with systemic health. The health crisis in our nation cannot simply be solved by one or two people. Together, we need to understand the crisis as a whole. And today we're here to talk about oral health. Oral health has a strong correlation with its effects with diabetes. We have 3 million diabetics in the United States. 3 million. Oral health has a strong correlation with cardiovascular disease, heart attacks, strokes. Oral health affects respiratory disorders. So the game is quite simple. Oral health and the importance of oral health is not isolated to oral health. If we want to control our healthcare budget and we want to provide our nation with the highest quality of care to our citizens, which is our responsibility, then it's critical that we recognize oral health as an integral part of total health. A tooth is an organ. It has a blood vessel, it has a lymphatic system, it has a nervous system. But currently, based on what Masshealth covers, it is not considered an organ, basically, because it's elective. Can you imagine your heart, your kidney, your liver, or any other part of your body being elective? It's a choice. You know what? The heart is broken. You have a broken heart. But Masshealth doesn't cover it. So let's take it out. Your kidney, you've got renal failure. But you know what? I'm really sorry. We'll give you a little bit of a dialysis to clean it up. But you know what? It's not a covered benefit. So let's just take your kidneys out. How could this be? How could the legislature, how could the people, how could our nation have such a deep misunderstanding on the importance of oral health? It's a shame, but it's a privilege that I'm here with the legislators who understand, who fought so hard for us. And it's a privilege to be here amongst so many of you who understand, who care. I would like to propose a simple question that you ask those you will meet today. If it was your mother, your brother, your father, your sister, and and they're suffering from organ failure. Organ failure, not saying teeth failure, organ failure. What choices would you like to provide them? A choice of extraction or a choice of healing? I think it's important that they understand that we need to heal our Commonwealth, we need to heal our populace, and we need to make the right decisions. And this is the time that we make those right decisions. This is the time we educate them. Thank you so very much. I appreciate it.